The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. We're right here in the middle of winter. I'm so excited to have my guest back on the program today. Stand-up guy, does things the right way. Scott Manning, say hello to everyone.
Well, Patrick, thank you so much. It's an honor. You know, I think every day people tell me they're getting their information from the Dental Brief. So good for you for the integrity and really the transparency you're providing to the dental industry and so many resources for everybody, but especially doctors.
Yeah, appreciate that. Thanks for the kind words. Sorry for a little confusion on my part this morning. I had a little issue with the studio, so here I'm at my normal, I'd like to call it a 9-to-5 desk, but my 7-to-6 desk.
You look amazing. You look great. This is what it's all about.
Thanks. Appreciate it. Scott, I got some books in front of me, 4 Freedoms of Dentistry. We've got Creating a Highly Profitable Dental Practice, Private Practice Dentist. I mean, I know you put some time into this, right? This is a lifetime of knowledge that's had you pen these books. What do you want to talk about today? I mean, we talk about anything. What do you want to talk about?
Well, look, I think, you have a great, powerful format of tapping into your guests and getting them to share relevant information to sort of present moment in time. So, I think that the books are great, but as you and I know, actions are what matter. I believe that this is the greatest opportunity in healthcare, but specifically dentistry, that we've ever had in our country. And it really has nothing to do with external circumstances. It has everything to do with the fact that more people are interested in optimal health than ever before.
Sure.
And it comes across in longevity. It comes across in biohacking. It comes across in aesthetics and appearance. It comes across in just wanting to be disease-free. And I think a greater percentage of people are putting their time, their knowledge, and their investment into being proactive and preventative. I don't care what we talk about, but I just think that this is the greatest opportunity for all of our doctors, the whole industry, to move forward into, a futuristic idea of dentistry and what we can provide to our patients.
I just heard this yesterday. I've read the book several times. It's been a while, but Napoleon Hill said in his Think and Grow Rich book, I think it was in that book, that he'd said that one of the best things that you can do in sales, and everybody's selling all the time, whether they think they're not, they are, or they're not. He said that one of the best things that you can do is, before you're talking to somebody, talk over the benefits that you can provide that person, right? So what are they going to gain from using your service or using your product? In your travels, I know you talk to doctors about really everything, but some of those things are certainly case acceptance. How many doctors do you think are doing that? And what if they did put that into their practice, where they actually said, okay, close your eyes and said, here's how the patient's going to benefit. Here's how the patient's going to benefit. Here's how the patient's going to benefit. And then went and talked to the patient about that. What do you think it would do for their practice?
Well, thanks for bringing up Napoleon Hill. I mean, you're talking about so many psychological principles, but just broad brushstrokes. Visualization, leads to manifestation. And I tell people every day, you underestimate your power to influence. And especially when you're doing it for a good cause, we can enlighten people to make bigger and better and smarter decisions for themselves. So what it would do, it would transform. Imagine this. Somebody comes in already skeptical, probably nervous, and their whole goal of entering a dental practice is that they find no work and they leave no money. Okay. Like that's every patient's goal. So we start with 180 degrees opposite.
Right.
So what you described, sitting down, talking about the goals, telling them what we can do to help them. And it preframes, it reshapes the patient's paradigm so that they're now looking at, well, I always say the greater investment, the more dentistry, the bigger the impact. So actually it's counterintuitive. Our goal is to build a bigger vision, is to be of greater service. And so I love how you're saying lead with the benefits, and also, and maybe, most importantly, you're telling the patient what success looks like.
Yep. And the marketing side of things, I know you know a thing or two about that as well. One of the things that I hear from potential new clients often is they say that the types of calls that they're getting, people don't have any money. people can't afford it, they're skeptical or what have you. And I'm like, you're so convinced that that's the case before that phone even rings. And they go, no, I'm not. I'm like, yeah, you literally just told me that. You literally just said that nobody has any money. You are convinced of that. And if you're convinced that people don't have any money or that they're not willing to part ways with it, they're probably don't, and they probably won't. Would you agree with that?
Oh,
Yeah.
100%. One of my great friends and very wonderful people in the whole law of attraction, Lee Miltier, she says you become a self-fulfilling prophecy. And again, it goes back to you have so much power. So either use your power for good to influence or use your power to self-sabotage, okay, and ruin it before it begins. So,
Right.
I love what you said.
So I have to imagine in dentistry, something is probably a little bit different than when somebody goes to, let's say, an otolaryngologist, and the otolaryngologist tells that person that, hey, it's obviously horrible, knock on wood, we don't want to see this happen to anyone, but you have throat cancer, or right, you have in your larynx, or you have skin cancer or something like that. They probably don't spend a lot of time talking that patient into taking action and treatment on that, do they?
Well, right. They deliver the bad news, and people go expecting bad news. And I think in healthcare in general, that's the way it's always been. I would like to say used to be, where people wait till they're sick to go try to get better. But that
Sure.
shift has occurred. It's already occurred and it's speeding up rapidly where people want to avoid, they want to prevent. And so I guess what I would just say to your point, I want you to imagine the psychology. Most people move forward to avoid wherever the past, bad health, problems, they move away from what I call away from. But what we want to do is we want people to move towards us. So whether we're here, that's what I call problem-based dentistry, we're here, possibility-based dentistry, it's the same direction of the patient. It's just whether they're moving away from or they're moving towards. And so when you bring this up, I would say this 100% in all of dentistry, whatever we say to a patient is good news. If we have to pull a tooth and remove disease, but we can leave them better than we found them, it's still good news. If we
Sure.
find some broken down teeth, okay, and we can repair them, that's good news. So we need to stop apologizing, stop feeling guilty, okay, stop minimizing, and really be amazingly proud. I always say, Patrick, if I said, hey, I would love to help you, but I'm really sorry that I can't. Nobody says that. So why would a doctor or a team member of any sort say, well, I'm real sorry you got this problem, but we can help you with it. It's like, no, you want to say, hey, this is amazing. You're here. We can get ahead of this. We can stop.
Mhm.
We can even make it better.
Wow. Just a couple of words make such a huge difference, don't they?
It's words, right?
Yeah.
It's
Yeah.
words. You know that old saying, and when we were growing up, they say sticks and stones break your bones, but words will never hurt you. It's like 100% opposite. Like
Sure.
actually sticks and stones, you'll heal from just fine. Okay. But boy, words, lasting impact.
Yep. All right. So one of the things that I've come across, I know great coaches, is that trying to get people to change is very difficult to do, right? If someone has to be ready, usually they have to be fed up, have to get to a place where they have to reach up to hit rock bottom, right? Something along those lines. But then they can always look back and know that, hey, they were given these little hints, these little clues along the way that they should have listened to in the past. So what are some clues that we can give people right now? What are some things that you can say to people right now that can open their minds up to working with a coach, to getting with somebody who can help them implement and execute a strategy that's going to change their lives?
Well, I think first of all, people are super smart to be right here listening to you, and I think it's a very, unbiased, unfiltered, broad source of information that the dental brief provides. I think the mind has to be open. And you really have a couple kinds of people that people may say they want something, but their behavior doesn't align with it. Those people are going to self sabotage. And you have people that, maybe they're stubborn or maybe, they're even fearful of success, not just fearful of failure. It's very important. They feel guilty about it or what will other people say? Or, that you hear all the time, oh, you work too much. Or, oh, don't you have enough? Okay. Oh, you really need that. Like you hear all these limiting belief statements to you. So I want people to be abundant minded. And the more you grow as a leader, a doctor, an entrepreneur, anybody as a leader, you're the source. So if you stay small, everybody else loses. If you grow and get bigger, everybody else gains. My point to you would be it's the definition of insanity. Nobody lives long enough to learn everything they need to know on their own. You just don't do it. and it'd be very painful. So
Sure.
you leverage books, coaches, consultants, other information. You master what you do, and you get help around you for all the other things that maybe you don't do. And that's how you shorten the distance. That to me is smart people want that. And everybody always uses the same expression about like all athletes have a coach, star players have a coach, all that. But
Yeah.
you don't want a coach that's going to try to change you. You want a coach that's going to try to empower you to discover and reach your fullest potential and to build a success environment around you.
Yep. Let me promote your books here. If somebody hasn't read any of your books, what's the one they should start with? What do you want to
Well, thanks for saying that, and you're very kind to do it. Either of the books you referenced are great. I would say people feel, they are attracted to the four freedoms just because of what it is. The freedom of time, freedom of price or insurance, freedom of the ability to be profitable. So it's just more independence, autonomy. And also what I call freedom from team turnover, which building a world championship team with a great culture, people who want to be there and are loyal. So like, that's a good one. I think if you want to just sort of a cliff notes of all the things that you can do to increase your success in dentistry, the profitable practice or whatever I called it there is back here somewhere. That's really probably, it's a great one because the point is building a profitable practice that you actually enjoy. And so to me, it's like, what's the line between, sacrifice and lack of fulfillment? Okay. And then in prosperity and freedom. Okay. And actually having fun and enjoying what you're doing. So I think that book would be the one.
Yeah. Great. Website. People want to learn more about you. Want to grab
Yeah,
a book?
sure. I mean, keep it very simple. I'll just say dental success today, which we say very important. It's on purpose today, not someday, not tomorrow, but dentalsuccesstoday.com. That's just kind of the catch-all. Certainly get the books. We do special things for any listeners of the Dental Brief and for Patrick's. But, I want you all to put Patrick to work. That's what I want. This guy has a brain unlike any other, and he's the most gracious guy. He's never tuned his own horn, but, really, you give so much to so many by doing this and everything else you do.
Yeah. Thanks a lot, Scott. That means a lot coming from you. I appreciate that. Scott, let's get you back on the program. Dentalsuccesstoday.com is the website, right?
Sir.
Folks, check it out. Reach out, grab a book, learn more about Scott. Scott, we appreciate you so much. Thanks for coming on.
It's an honor.